Autism News Network.
We first learned about this unique project when MUSC psychiatrist Dr. Frampton Gwynette and producer Tyler Prescott joined us in our studio to share more on the Autism News Network. Today, we take you to their production studios downtown for an inside look at the operations and mission behind this exceptional endeavor.
Going back to our origins, it started in about January 2018 when we realized that there were a lot of young adults with autism who were in our clinical programs here at MUSC, but might not be necessarily flourishing socially like we believe they could. They're intelligent, very talented, hardworking, but social connections are difficult, and therefore higher education can be challenging. Job settings are hard. So we really wanted to put all that together and say, what if we created a social program to build social skills but also build job skills? And we did that under the auspices of a journalistic model where we had a new news network where all the content was written, produced, and directed by adults with autism. And from there, it really slowly but surely gathered steam. Doing an interview with a guest involves so much preparation in advance, thinking about questions, interacting with eye contact and nodding and responding to their conversation. And that piece, we've coached that from the ground up. And we've seen a lot of our participants, who began very uncomfortable in any social setting with a lot of anxiety, start really excelling at doing interviews and thriving on being on camera. And so and then they've been able to carry that over into their personal life as well.
Yeah. Now, in your practice, did you always work with people with autism?
Yeah, from my training in child and adolescent psychiatry, I really started to get interested. And once I came to MUSC, I realized that there was a huge opportunity to serve, patients of all ages and their families. That's a big part of it. And we've had a tremendous support from many parents who are also here today with the Autism News Network. And they inspire us and they help us, be encouraged to keep going forward.
We sat down with one of those parents, Melissa Blake, whose daughter, Kristina, is an editor for Autism News Network.
This program here at MUSC has pretty well saved her life. Kinda, right?
Yeah. How so?
Yeah. Kristina, she couldn't even talk to anyone without passing out. When I first brought her here, heard about the program, she was holding on to the doorway, pale as a ghost, not wanting to come in. So, it's an incredible turnaround. It's been a slow process, but she is conquering hurdles all the time.
Kristina is now 27 and has been working for Autism News Network for 4 years.
I enjoy going to do interviews outside of MUSC.
But Kristina, whose nickname in the newsroom is Drama Queen, says she's her toughest critic.
For instance, on myself, I get frustrated when I'm walking at home and I can't get the sound right or stuff like that, and then I just end up turning it off. But I'm also the type of person that I don't quit until it's done.
For 21-year-old Melissa Goldfine, working on Autism News Network has helped her come out of her shell.
It's helped me to become public to the world.
And were you very shy before?
I was a little nervous before.
Mm-hmm. So you started off in child and adolescent psychiatry,
Yep.
But the Autism News Network is a place for teenagers, but also young adults.
Yes.
To work.
Absolutely.
Yeah.
And as a child psychiatrist, I had to start processing that my young patients were growing up and becoming adults, and the needs change. And also the services available to adults with autism is much, much less versus kids, because autism is kind of identified as a pediatric condition. Mm-hmm. And there's a lot of services relatively in childhood and even high school, but after high school, a lot of people call it a cliff, where you kind of fall off this cliff, and if a lot of effort isn't put in, many people end up playing video games on their parents' couch, and that was something we really wanted to change. Mm-hmm. The first incarnation, my thought was, how about I go on camera and start telling people everything I know about autism. I pretty quickly realized that where the gold is having them be on camera and to tell their viewpoint and to tell stories that they're interested in and they're passionate about, And then that's just where it took off.
I want people to know that people with autism often feel misunderstood.
I'm Chris from the Autism News Network. Would like people to know that people with autism have other mental health conditions like ADHD, anxiety, and depression.
Hi, I'm Kyle from the Autism News Network. I want people to know that people with autism can accomplish goals and be an important member in their community.
From a single idea or interest into the field with questions and cameras to the editor's desk, Autism News Network has produced some 80 stories, but they don't want to stop there.
And ultimately, we want the news network to be a place where adults with autism can go to work, as in their career, have a meaningful career in journalism, where they learn social skills and vocational skills, and they get paid to do their work right here at the Autism News Network. We created a nonprofit organization, and our hope is if we can get funding there, we can employ them. And some of our participants might have Social Security, disability income, or Medicaid, and that for them right now is that they see that as their ceiling. What if you had retirement and had health insurance and had a salary and you came in here, and my role then would be to supervise and support. I wouldn't be their boss, but I would still be their doctor at all times.
To learn more about the program and watch their stories, you can visit their website, theautismnewsnetwork.com. We'll be right back.